when we talked about on a conference call in preparing for this session usually take one issues, and we thought, Salmonella enteritidis in relation to the egg safety rule would be an issue because it created a lot of commotions in our industry because all along testing for Salmonella enteritidis was just a voluntary program by the states. So when in July, when it is published in the Federal Register, the FDA rule, it made it automatically mandatory because in order to sell eggs, they have to abide by the egg safety rules, and producers were very anxious because the egg safety rule prescribes a very detailed program, especially in laboratory testing, and also on-farm monitoring, which undoubtedly will follow auditing by FDA inspectors. So it makes them very nervous. And to this date, I think they didn't get used to it, but FDA has started auditing some of the farms now, and they are pointing out some recommendations again. So just to give you a little bit more about our involvement, we in California have 4 laboratories. Until July of 2009, we were 5. Because of the economic downturn, we were forced to close one of our labs in the Central Valley, in Fresno, which was mainly a poultry lab. And we consolidated our programs to the other laboratories. Turlock remains the only poultry lab now we have, but Davis, Tulare, and San Bernardino, in the other labs, they are full-service laboratories. They accept also poultry. So the laboratory as a whole in California, it's one system. The main facility is located in Davis, and it is also providing full service for the mammalian and poultry. It houses our analytical laboratory for equine drug testing. So we do a lot of racehorses. And the testing is conducted there. Also, we have the virology and the electron microscopy toxicology services there. In Tulare, just mainly dairy, and also now they started poultry. In San Bernardino, it's diagnostic service. In addition, we do a small component of food safety. And we do a lot of egg testing as well as dairy product testing. So just like any other laboratory, our mission is livestock and poultry, health management, food safety, public health, equine health, and of course, being affiliated in the university, new knowledge plays a big role investigating outbreaks and others. So my objectives for this talk would be to give you a historical background about Salmonella enteritidis, just about the spontaneous appearance of this organism worldwide, from Trinidad to Ireland, from Japan. It's just amazing. To this date, it is not fully explained why it just came out on the surface all in a sudden. There are several theories behind it. Just the shipment of chickens by big companies from one continent to the other, and really that doesn't explain it. Why did it happen just on that time? So really epidemiologically that's not fully explained yet. And the emerging of Salmonella enteritidis phage type 4. This is the bug which created a lot of economic distress in Europe to the resignation of some political figures. So it appeared in California for the first time in 1994. Fortunately, it was not very virulent as it appeared in Europe, but nevertheless, it appeared in California for the first time. I'll talk a little bit about that. And also addressing the Salmonella enteritidis problem in California, the establishment of the voluntary air quality assurance program by the industry. I think Pennsylvania and California are the forerunners for this type of program, which became more common in other states later on, and also the laboratory testing. Then the FDA final rule about the laboratory perspectives, and in general about laboratory testing methods, their fees, the turnaround times, and the economic impact of SE-infected layer flock. I will just give you an example how it affected a single producer in California when it happened. You know, it's just amazing how much money a producer could lose, especially now in the light of the SE rule. I think it is very prudent for a producer, you know, to monitor and do surveillance on a regular basis. It emerged in early 80s to late, I believe, 80s in Europe. Especially it started in broilers in the UK, but before in 1987 it was rarely, seen. And the proportion of the Salmonella enteritidis, based on other, proportionally from other Salmonellas, it's ranged in 1979 6.3%, in 1983 33%, and then in 1954 57, and in 75% of those isolates from the SC were phage type 4. And it's in the 80s, early 80s, mid 80s in the eastern United States. It spread to Midwest and the Southeast. And in 1975 and in 1987, in the U.S., the proportion of Salmonella enteritidis almost doubled. In Europe, it tripled, and 75% of them in South America, in Argentina, were SE. In mid-90s, reached in the West Coast, and it increased proportionally 3.3% per 105 to 7.9 to 105,000 people. So in the United States, as you see the graph, the color doesn't show here. The top one in the northeast, the peak was in the late 80s, and it dwindled and went down to probably 99. In 99, towards about between 5 and 10%, and in the south, it ranged from the peak 90 continuously to 99. And in the West, it had about an average of 5% throughout. But even then, it is, higher than what it was reported before. In California, it was really very, very high in the 1994 through 1995. This is per 100,000 people. It ranged from the highest point, 7.9 per 100,000 to 3.1% in around 2,000 per 100,000 people. This, probably the last time we saw it in California was egg-associated Salmonella enteritidis about 10, 11 years ago. Since then, we haven't seen it. Probably this is part of the egg quality assurance program. People were very diligent testing, and some of the core programs in the egg quality assurance program helped that. Especially monitoring chicks coming to the ranch. The chick peppers are tested, and if the chick peppers are positive, the chicks are not introduced to the farm. That made a big difference. And the other thing was when placing the pullets onto the ranch, the environment is tested before the chicks were placed, and it has to be negative environmentally at least for the chicks to be placed, and that probably played a major role as well in reducing Salmonella enteritidis. So the Salmonella enteritidis phage type 4 was first recognized in the United States in Southern California in the county of Riverside. During that time, we were monitoring chickens, just for routine mortality. And on several occasions, on one farm, we found this unusual lesion with hepatitis, peritonitis, and insipitated eggs in the abdominal cavity, and it came on different days for different pathologists, and we were talking about that, and what is this happening? So we had agreed with the producer we will do only gross or cursory examination, and we didn't want to culture because he didn't want us at the beginning. So we came in agreement, and we can culture, but we don't serotype the organism. So we finally asked him, if he's willing to do that. So he agreed, and we cultured it and became Salmonella Group D, which Salmonella enteritidis is part of it. So in further examination, he was, convinced, and because it's happening in several of his houses. He has 8 houses, and 5 of them were involved. So we reported it to the regulatory agencies, and they convinced that probably it needed to be further investigated. And it turned out to be Salmonella enteritidis, and that was phage type 4. And when we did the epidemiology on that particular isolate, it turned out to be, it started as a source from a sewer treatment plant just about half a mile upstream of the houses. And we managed to culture the organism from there, from the treatment, from the effluent, which, by the way, the effluent runs about 50 meters away from one of the houses. And there were rodents, and we cultured from the rodents. And there were cats on the farm. We cultured the organism from the farm, the eggs and the chickens, and they all had the same plasmid profile. So it was no doubt, it came from the sewer treatment plant, probably humans, and then to the environment and to the rodents, and eventually the rodents went into the house, contaminated the feed. That's how the chickens were contaminated. In short, that made a big impact on the owner. He lost about $2.4 million because he couldn't sell the eggs. They had to be diverted for pasteurization, and also the cleanup, the laboratory testing, and the consecutive testing, because it was required of him in order to sell the eggs as stable eggs. He had to have 4 consecutive negative results on the eggs, which are tested every 2 weeks. So he followed that, but in the end he lost a lot of money on pasteurized eggs rather than destroying. So I'll show you some figures on that down the road. So after the recovery of the discovery of the SEPT4 in California, so there was this interagency meeting which included USDA, California Department of Public Health, FDA, CDFA, and the university, and they were talking about how to address this issue. So fortunately they were in one room and they are discussing, but before then there was pointing finger, and the reporters found always on the newspaper. So the industry was tainted really, and whenever there is SC associated egg published in the papers, egg prices go down. So I think it was a good thing, this interagency team, they were meeting and discussing, and the industry, using those resources, developed a California Egg Assurance Program, which was really became very beneficial for the industry in general, which had 20 core components. The major ones in there are, I can say, to purchase chicks and pullets from hatcheries and that are participating in the National Poultry Improvement Plan. And also chicks should be delivered with a certifying letter and implement a Salmonella enteritidis environmental monitoring program at least once during the life of each lay flock while on the lay farm. So these are, I think, very fundamentals in the total reduction of Salmonella enteritidis, and I think this is what helped the industry moving forward. And I think these are still the basic requirements for the industry. So the laboratory testing is very involving. It takes, taking drug swabs and taking that into enrichment broth, and then putting it on selective agar, and then picking the suspect colonies, confirming that, serogrouping, serotyping, a process which takes up to 7 to 8 days, and then serotypes on top of that. And the NPIP program also prescribes a delayed secondary enrichment program protocol, which allows the broth to sit about 3 to 5 days, and then subculturing that. And again, this takes additional days, up to 11 days in total. Rapid test was probably something which the industry wanted, especially testing eggs, because for the movement of eggs to the market, they need a rapid result. So later on, we developed a test which now is approved by NPRP and also recognized by FDA. And this is implemented in the laboratory system. And we, in collaboration with the Livermore people, this is a test which very specific for Salmonella enteritidis. And this test recognized the universal Salmonella PCR as well as the SC specific band. Again, this takes about 3 to 5 days. This is just for about 11, 15 years we did Salmonella enteritidis culture, and in general all Salmonellas from 1991 to 2006. It is amazing how many cultures with the traditional way we've done, close to 80,000 cultures, chick peppers about 2,500, and PCR 2,511. As you see, the one in red is the prevalence of SE with the dotted broken lines. You see here, over here, is that inflated because that is a farm investigation we did. And the next broken lines, you would see that is also a surveillance we did. So some of the farms were repeatedly tested. But overall in California, the Salmonella enteritidis is less than 5%. But as you see, all the Salmonellas are rising. Just this is because whether we have a more sensitive test or we are now testing more than before. But it's the industry really submits a lot of samples for testing for Salmonella. So the laboratory perspective, the SE final rule. With this rule, the environmental sample be analyzed in accordance with the FDA prescribed method entitled Environmental Sampling and Detection of Salmonella in Poultry Houses. This is different because of, than the voluntary program, which requires the industry with a certain interval of times to test and also document and show really good records when the auditors come. So one, the reason is for verification on-farm egg safety program. Usually they use drug swabs, and also for outbreak or traceback investigation, which involves manure piles, egg belt, fans, and all those things. And the FDA BAM method, it describes all the components, what is required for testing. Samples are to be taken by using gauze, 10 by 10 centimeter, and a pad and moistened pad with evaporated milk. After sample is collected, the pad is put in a whirl bag, refrigerated, and sent to the lab. It prescribes a certain method for the lab the sample preparation at the lab, and vigorously mixed, and for about 10 seconds, and incubated 24 hours. And from there, This is a little bit different. It requires 2 enrichment broth. One is in tetrathionate broth, and the other one is in Rappaport fasciolidis broth. And both are incubated and then plated into selective media. And then from there, about up to 5 colonies are picked and worked out at Salmonella. Suspicious colonies are tested for, by biochemical means. And then identify the Salmonella is, of course, they are only interested for Salmonella enteritidis, not the other Salmonella, so it has to be serotyped by the traditional means. The biggest bottleneck is egg sampling because it has to be moved in through the market quickly. And also once the environment is positive, the eggs have to be tested in order for the producer to sell eggs. So if the environment is negative, then until the next scheduled time, the producer is not required to test the environment. So, every time when they test eggs, it has to be about 1,000 eggs are collected from the day's production from that farm and brought to the lab. And if those eggs are negative for 4 consecutive times, and a producer is free to sell eggs. So again, this is a detailed procedure to culture the eggs. It takes at least up to 7 days just to isolate the organism, and if it is negative, it is 7 or 8 days. But if it is positive, it may take 2 or 3 more additional days to confirm that Salmonella enteritidis. So a total of 11 days. So with a traditional FDA culture method. So these are the different tests we have and their test codes. Just routine Salmonella culture, it takes it costs about $13, and we have different tests for the eggs. If we have to culture it, it costs about $45 per pool. One pool is a composite of 20 eggs. So for 1,000 eggs, it's 50 pools, so 50 times 45. It gets very costly. Imagine culturing per house 1,000 eggs or 50 pools. If you have 10 houses on the farm, it gets very, very costly. We have some in the pipeline, SE-specific PCR, that's not very well used throughout the labs. We used it just for informational purposes because we have not validated in our lab. Also, it is approved by FDA. So even then, we had just a conference call with FDA last Friday. Even if the SE is positive, you still need to isolate the organism. Okay. So this is the turnaround times varies from 3 days to 10 days. And these are the different rapid assays now commercially available. Again, these are screening tests. If we need to confirm them, it takes additional days, total of 5 to 7 days. And this is the SC5 type form infection in a commercial flock I mentioned to you earlier. the different houses, and the last column, the net loss, that is after deducting, the diversion and the income obtained from diverting those eggs. So it comes out, including the vaccination and the professional fee. This person lost about $2.5 million. So in addition, there were other costs like bringing the eggs for testing. We tested close to about 100,000 eggs. It's almost $1 per egg.